Now, without further delay, I'd like to introduce Project Open Hand. Speaking with us today are Isabel Eskin-Shapson and Erica Trebet. Isabel is the project manager of special programs and partnerships, and Erica is a nutritionist. They'll be sharing information about the organization, its programs, along with education relating to how nutrition is medicine.
Hello, everyone. Like Twin said, my name is Isabel Eskin-Shapson. I'm here to talk about Project Open Hand Services with one of our nutritionists, Erica, who is just sitting above me on my screen. We are really excited to be here to talk to you all about POH's services and provide a little bit of a preview as to what sort of programs we offer. If you have any questions, we look forward to taking those at the end. So just keep a little note of that and we can get started. You can go to the next slide. Thank you. So I just wanted to start out with this quick stat. 1 in 4 San Franciscans are at risk of food insecurity. This was from a study in 2018, and that same study also said that it was only increasing. So you can imagine where those stats are today. Food security is something that a lot of us may have heard talked about in the past. It's about having access to food. But we like to think at Project Open Hand that not only is it important to be food secure, to have access to food, both financially, geographically, and everything like that, but it's really important that you're also nutritionally secure. And what that means is that your food is appropriate for your nutritional needs, whether that is because of a certain diagnosis you have, your age, any of those factors. So that is kind of where Project Open Hands ethos comes from. Go to the next slide. Thank you. So the first program that I wanted to touch on is our wellness program. This program provides medically tailored meals and groceries for the critically or chronically ill in both San Francisco and Alameda counties. I'm not sure if we have folks from who live in Alameda County on the call right now. If you do, just give me a heads up. Either in the Q&A or towards the end, and I can touch on the Alameda specific programs that maybe I haven't touched on in this. This is kind of an overview of the wellness program. If you can go to the next slide. The services that we provide through the wellness program are twofold. The first is the food itself, and those are medically tailored meals and groceries. And what medically tailored meals means is that it looks like we do have an Alameda attendee. Hello. That the meals themselves are created specifically for the nutrition needs of different chronic illnesses, different age groups. We have one program that's specific for seniors, things like that. Or if you're a diabetic and you need a carb controlled diet, that's what we mean by medically tailored meals. In this program, we can also serve food to any dependents you have. So children between the ages of 5 and 18. We offer this food distributed either by pickup or delivery once a week. And that can be in Alameda and in San Francisco counties. And then the second big component to the wellness program is the nutrition education opportunities in groups, the one-on-one consultation with our registered dietitians and nutritionists, and the cooking classes, some of which are online right now, and some of which we are really hoping to bring back in person sometime soon. Next slide, please. So in the wellness program in San Francisco, there are certain eligible diagnoses that mean that you can access these services. These diagnoses are listed here: HIV/AIDS, hepatitis C, COPD, CHF, coronary artery disease, type 1 or type 2 diabetes. And then the last one is a recent major surgery. And for that, that's a shorter term service that you don't need to have any of the eligible diagnoses for. So say you go in for a surgery and you're back home and you're just not feeling up for cooking for a couple of weeks, we can send 7 meals a week to you that you just got to pop in the microwave. It's really easy. For all of the diagnoses besides HIV and AIDS, we provide about 1.5 years of services. And at the end of that time, try to connect folks with other programs that either we offer in-house or that are in the community. All right, next slide. So this is just a quick overview of our application process for the wellness program. The application, which I will send to Twen, which will be shared out in the materials after this webinar. The application must be completed by a licensed medical provider, and that's a doctor, a nurse, a physician's assistant, nurse practitioner, a social worker, a dietitian. And the reason why we have a licensed medical social worker complete the application is because we want to get that information about the diagnoses so that we can really tailor your food for you and what you need. The next thing that happens is that the provider will send it to our client services team, and that is email, fax, or the client themselves can just walk the hard copy into our office if they'd like. We will then process the application, and if you're eligible, give you a ring. When we call, we'll do a small short intake, and that's sort of collecting some demographic information, collecting some more information on allergies, dietary restrictions. When would you like to get the food delivered? If you would like it delivered, when can you come in and pick it up? If you would like to come and pick up, information like that. You'll then be referred to one of the dietitians for a nutrition assessment. And as soon as the intake is complete, you will be able to access the meals or the groceries. Next slide, please. Actually, can we go back 2 slides? Thank you. So just a small difference for Alameda County. Everything is pretty much the same, except the diagnoses that we serve. And I can just overview those real quick because I only stuck to San Francisco information in this presentation. So HIV/AIDS is still covered in Alameda County, hepatitis C, congestive heart failure, diabetes, and they also are able to, and the major surgery, they're also able to serve folks with stage 2 or stage 3 cancer, any type. And then you go through the same process. All right, thank you. All right, we have a newish program through San Francisco Health Plan. So this program is very, very similar to the program that I just talked about, but you do need to have San Francisco Health Plan as your primary insurance. So this serves a slightly different eligible group, just some different diagnoses. For example, in this program, we do serve folks under the age of 18. And that's pretty unique for us. We tend to serve folks over 18. And then we have some other medical conditions that we also are able to serve through this. This program, again, it's funded through San Francisco Health Plan. It's funded through that insurance. So what happens with that? It's pretty much the same thing. It's just a different application. Your medical provider fills it out. they send it in to us, and we go through the intake process. In all of our programs, every 6 months, we, except for the 6-week, of course, we do another recertification is what we call it, where your provider fills out the application again. And then that's just a really good opportunity for us to make sure that we check in with you, see how the food is working for you at that point, see if there are any adjustments that we need to make. But folks can always call us to make those adjustments if that 6-month period is too long. I'm not seeing anything in the Q&A quite yet. Okay. So going to the next slide. Again, it's the exact same process for the San Francisco Health Plan. Just the major difference is some of the diagnoses that are served, and the fact that you do need to have San Francisco Health Plan as your primary insurance in order to enroll through that program. Next slide, please. The next program that I wanted to highlight is our program through Medi-Cal. So this is for folks who have Medi-Cal. I don't know how many folks here in the room, the online room, have Medi-Cal, but this is a new program that we're offering through the end of June. And so whereas in the other programs where folks can receive up to 7 meals a week and 1 grocery bag, this is a program where folks can receive up to 21 meals a week plus a supplemental breakfast and snack bag. So right now it is a limited time program. We are hoping to extend it, but that sort of remains to be seen. So if you, any family members, friends, neighbors want to take advantage of this program, I highly suggest moving quickly to really maximize your time. And this is a 6-month program. Thank you. Again, the process is very, very similar. It's just a slightly different application. I will get all of those applications out to Twin so that you have all of those accessible. Great. Then I wanted to talk about our community nutrition program. And this is our program that is congregate sites serving nutritious meals every day for older adults and adults with disabilities throughout San Francisco. Unlike the application process involved with the wellness program, there's no advanced sign up required for this program, and walk-ins are welcome. This map, unfortunately, has not been updated since COVID. So again, I will send out the list, but I don't know, Twin, if you clicked on that link, if it would open.
It would, but I think that it would disrupt the screen share briefly. So I think I'll include it in the post-event email.
That sounds good to me. But we have meal sites all throughout the city where you can just walk on in and get meals. Depending on the site, you can either pick up frozen meals for the week, or you can come in for a hot meal every day. And before COVID, we were able to, in every single site and every single day that these were open, provide hot lunches where folks could come together, activities, things like that. Obviously, we've had to pivot with COVID, but hopefully we are going to be returning to that soon. The one real requirement for this program is proof of vaccination if you would like to dine in one of the sites. And then the other thing is that for adults with disabilities, we do not require proof of disability. I have a question here in the chat asking if the menu is limited. I am not totally sure what you mean. What we serve is, it rotates every month. And this is something that'll be shared out with the material, but we have menus that are distributed at the beginning of the month so you can see what's coming up for the month. I can just kind of pull one up right now and see what we served today. Okay, so for example, for lunch today, very small, we had a roasted sweet potato soup with a Moroccan beef stew, bulgur pilaf, broccoli and cauliflower, and the fruit of the day. So if you dine in person, you are able to request to skip the meat portion if you're vegetarian. And yeah, so hopefully that answers your question. If not, at the end, you can unmute yourself and hopefully I'll be able to dive into that a little bit more. Okay, each of our meals provides about 1/3 of the daily required, daily nutrition requirements for the average older adult. Okay, next slide, please. I wanted to touch on just really briefly some of the impact of our programs. For instance, we were able to evaluate one of our programs, particularly for folks with diabetes and heart disease. 93% of clients served through our diabetes and heart disease program maintained or lost weight. 82% had either the same amount or reduced hospitalizations. Folks were able to maintain or increase their medication adherence, which is awesome. And the next slide, please. And this was really great. I don't know how many people are familiar with the HbA1c, but basically it's blood sugar. And 66% of folks who participated in this program were able to maintain or decrease their A1C, which means that you're managing your diabetes better. Folks were really thrilled with their participation in the program. We weren't expecting to see this, but 98% of people responded that the participation in the program really helped them improve or maintain their health, which we were really thrilled to see. Next slide. Awesome. So this is the last program that I wanted to talk about. And then I will turn it over to Erica. So Project Agewell is one of our newest programs, which we're really excited to be launching or have launched. Erica is the main nutritionist on the program. And this is a program that is aimed at reducing social isolation and nutrition security for folks over 60. Right now, we're doing this in San Francisco County, but we'll soon be moving it to Alameda County as well. So this is done through integrating telehealth technology and long-term support services. So the idea behind this is that small peer groups come together once a week online, learn about a health topic, much like you're doing here today, much like you do with these webinars. And ideally, this education improves nutrition and food security, improves folks' health and wellness, reduces social isolation, and then a big part of the program as well is linking folks to longer term services after the end of the program. Can you go to the next slide, please? Oh, well, that is not the right title, I apologize. But this is a little overview of Project Agewell. So like I mentioned, small groups of people meet once a week with a registered dietitian and care coordinator. Clients have the opportunity as well to participate in virtual one-on-one sessions with Erica in her role as a nutritionist, and our coworker Sammy as her role as a care coordinator. Through this program, not only do you receive those online classes and participate in those, as well as the one-on-one sessions, but we also have either meals or groceries delivered to folks' homes. This is a 16-week program. So after those 16 weeks, again, like I said, a really big part of this program is connecting folks to either programs that we have in-house or other programs in the community, because 16 weeks is not a lot of time. And we want to make sure that we set you up for success at the end of that. All righty, I'm going to turn it over to Erica.
Thank you, Isabel. And I'm sorry if some of you might hear my loud cat in the background. I am a crazy cat lady. That is something unique about me, I suppose. But thank you for having us here. And again, my name is Erica Tribbett, and I have been a member of Project Open Hands team since May of last year. And as Isabel mentioned, I work primarily with our Project Agewell program, but work with this lovely team that you see here, the nutrition services team at Project Open Hand. And so we're really focused on both creating meals that are set to evidence-based standards for the management of certain chronic conditions. So we'll talk a little bit more about that. But we're also here to support you or anyone who joins any of our programs throughout the time that you're with Project Open Hand to make sure that you have answered any questions that you have regarding nutrition and your health, answering anything that may be of use to you in your own kitchen. So applying some of the principles from our meals at Project Open Hands into your own life in your own way. And so we're here to provide guidance and support throughout. And I did just want to touch on briefly what Isabel was mentioning about medically tailored meals. So many of you may be familiar with this concept, but just wanted to be very clear again that medically tailored meals are meal plans that are tailored by a registered dietitian nutritionist. And we work with our kitchen staff to create things that are delicious, but also very crafted with the design to improve health outcomes, as Isabel was mentioning in some of our outcomes that she shared. And medically tailored meals at Project Open Hand can take on a variety of forms. I've listed a couple of examples here just to give you a snapshot of what some of these might be. Our wellness meal is our house meal, essentially, that meets the guidelines for a heart healthy diet. So we're looking at what some of you may have heard of as the DASH diet, or dietary approaches to stopping hypertension, as well as the American Diabetes Association standards for diabetes management. So it's for all of our clients who are living with any form of heart disease, congestive or coronary artery disease, things like that, but also diabetes. We also have a renal diet, which meets the guidelines for care of stages 4 and 5 chronic kidney disease, as well as anyone who is living on dialysis. We also have a bland meal plan that meets guidance for the care of very special conditions such as GERD or frequent nausea and vomiting. This may be useful if someone is undergoing certain cancer therapy treatments. We also keep them low odor, easily digested food. So this can work with irritable bowel syndrome, things like that folks may have individual to their own condition. We can also modify the texture of our food. So if we need something that has either mechanically soft, so if we have some issues with dentition or swallowing, we can make our meals soft or fully pureed. We just need to know about that in advance so that we can set up meals to meet those needs. We also offer a vegetarian meal. And so we try to meet also dietary preferences in addition to the tailoring for medical needs. So just wanted to give you a snapshot of that. Now, what do we mean by the client experience? Once you are enrolled, once we've gone through the steps that Isabel outlined nicely for us to get involved in one of our programs, she mentioned how you have an intake with one of our registered dietitians to see exactly what your dietary needs will be on one of our meal plans. But we also like to do an individualized assessment that goes a little bit further. So we talk about your nutritional needs, your health-related goals, potentially any other wellness goals you may have. We try to provide support beyond the meals and that complement the meals. So you'll receive these weekly meal deliveries or pickups, and we want you to know what to do with these and how to integrate them into an overall whole diet that is benefiting your health. We also like to think of Project Open Hand meals as a learning tool. So either in our one-on-one sessions together, or as Isabel mentioned, some of our clients will participate in small group classes. We like to use the Project Open Hand meals to really showcase the types of foods and the types of cooking methods and preparation that you can apply in your own kitchen if you're able to and if you enjoy it, to bring this to your daily routine. Again, we talk about goal setting and self-monitoring. So thinking through, in addition to receiving Project Open Hand meals.
Erica, I
Yes.
apologize. I don't mean to interrupt, but did you want me to go to the
I
next
should have
screen?
said next slide. Yes. So we're a couple slides ahead now. Sorry about that, folks. Hopefully I was clear in my verbalizing.
You were.
Okay, so we'll go back one slide. There we go, to client experience. There we go. Okay, so we'll focus on goal setting and self-monitoring. This is, again, largely to supplement what we're providing with meals, but making sure that in addition to that, if you have any specific goals on your mind, that you have the tools that you need and the resources available to you to reach them. We also love in our classroom settings, if you're able to participate, the peer sharing and peer learning. You all have been living in this community for some number of years and have your own lived experiences. And I think that there's a huge amount of value, our whole team does, in allowing each other to share what these resources are to meeting our goals. So that's a little bit of what it looks like once we're enrolled in the client experience. If we can go to the next slide. When I say support beyond meals, I just wanted to give a little snapshot of the individual check-ins that we have. And this is both to establish a relationship. We really like to get to know you as a person, what it looks like to move throughout your day, what your context looks like, so that we can understand how we're going to best support you. We want to gauge understanding of health and nutrition. We understand folks have different levels of knowledge, different levels of interest, different levels of skills and abilities. And so thinking through that. And then we also always conduct a 24-hour recall assessment, which helps us give a foundation for where you're starting from in your daily diet. And so we'll ask you to recall your diet from the time you woke up the morning before until the time you went to bed. And we'll use that as a conversation guide. Again, we'll identify goals and values that are important to you and answer any health-related questions that you have along the way. And we always make sure to follow up. This looks different for each individual. For example, in the Project Agewell program, we have 3 standard check-ins one-on-one throughout that 16 weeks, but this differs based on client, and you can always request to meet more often or less often, whatever meets your needs. Next slide. Again, when we are thinking about individual sessions, we also do offer small group classes. As Isabel mentioned, right now, a lot of these are online, but we do like to have them in person too. We have a fantastic facility down on Polk Street in San Francisco that we like to have folks for cooking classes and demonstrations, but we also do some of this online. We have Zoom classes where we are doing a little bit of cooking, getting in the kitchen, but we also, again, are doing some resource sharing. We talk about what's available in our community. We'll talk about several tools that we can use to make healthful choices. One of the things that we do most immediately is we understand that Project Open Hand is one resource, but just as we're learning, you learn in all of the calls that you may join in this setting, we know that there are a lot of other resources out there. It's just a matter of getting connected with them. We can go to the next slide. So we try when we meet with our clients to establish an understanding of what resources someone is currently utilizing, what they're interested in and eligible for, or what they may not be interested in at this time, and continue to check in based on that. Examples might include receiving extra money for food, so facilitating connections to CalFresh or SNAP benefits, or what we know as food stamps, or vouchers for veggies and other sort of farmers market vouchers where we can increase the amount of money that we can spend at the farmers market on fruit and veg. We can also think about groceries, and this may be something like a connection to the San Francisco Marin Food Bank for fresh groceries, but could also be if we have mobility challenges, if we have trouble leaving the home to go get our own groceries, we can potentially facilitate support from a volunteer grocery delivery service as well. We think about congregate meals, as we mentioned, our community nutrition program, but we also know that there are a variety of other congregate meals or hot meals in a social setting in the city and in Alameda County, so we can connect those opportunities, and also support in shopping or preparing meals in home support services if need be. Next slide. Again, we always start from a point of what did you eat yesterday? We find that just starting with that is somewhat illuminating. So again, beyond Project Open Hand meals, what does our diet look like? Where would we like to focus, and how can we support our health? Next slide. When we're talking about nutrition at Project Open Hand, again, we like to think about what actually impacts our day-to-day life and impacts the decisions that we make about what we eat. So in some of our classes or our one-on-ones, we might talk about daily habits and routines. We might talk about, and we will definitely talk about, what do you like? What foods do you like? What tastes good? How can we accommodate those things? Again, your medical conditions, of course, and what you've learned about nutrition, but also how much do you want to cook and what are we willing to learn? What is available to me in my community, and how can we provide opportunities for low cost items and strategize around that? And then also, how can we clarify certain messages that we may have heard from any source about nutrition and food and make sure that we're all getting accurate information? Next slide. Okay, and this I just wanted to point out because I think we're all on board here when we know that food and nutrition and meals with love from Project Open Hand is something that we are passionate about, but we also recognize that we want to address all dimensions of wellness. So to the extent that we're able as an organization, we do like to assess and as much as possible, connect people with resources that are going to address these other aspects of wellness, because those all hang together in overall health and well-being. And I just want to give a snapshot finally of some of the approaches that we take in our classes, some of the topics that we may cover. So I'll just do a quick run through here. Next slide. One of the things that we talk about in our small groups is asking everyone, what are your ingredients for eating well? If I could see all of you and we could raise hands and talk, I would ask you, what would be a healthful diet for you? What makes you feel good about what you're eating? And a lot of times this is based in real food versus learning the difference between that and ultra processed food. So we look at food labels and ways to determine the most optimal choices there. We look at a balanced plate, how to balance our plate. We look at getting variety from each food group, how to personalize based on our needs and maintain the flavors that we like, while reducing things like added sugars and salts that may not serve our health quite so much. Next slide. This is an example of using our Project Open Hand meal as a guide. So on the right is one of our meals that's been plated and photographed, and we just show it as an example of a balanced plate so that we can talk about how do we get these nutritious non-starchy veggies throughout our day, our complex carbohydrates, selecting lean proteins based on our dietary preferences and things like that. The next slide. Okay, and then here we talk about portion sizes, both with fruit and vegetables, to understand, are we getting our 5 a day or more, and what that looks throughout the day. Next slide. We can also look at more energy dense foods and things that we may just want to portion control if we're interested. So we might look at things like cheese, butter, peanut butter, meats, and look at what does that actually look like with the handy tool of our hand. And so if we match all of these up, we go to the next slide. We talk a little bit about, okay, a pat of butter is the tip of our index finger. We talk a little bit about nut butters and more energy dense. By that, I mean that they are more higher in calorie content, may have higher levels of fats or saturated fats, depending, but those types of things we may want to watch portions. And the palm of our hand is always useful for that 3 ounces of meat that we often are served a little bit more of. So it's a good reminder. The next slide. In addition to making choices about the types of foods that we're selecting, we also look at what does it feel like to be hungry? What does it feel? Why do we choose to eat? And some of these times it might be mindless. It might be a little bit of emotional eating. We can look at a physical hunger scale, and we try to provide opportunities to get back in touch with our body and identify what it feels like to be ravenously hungry, or just having a hunger pang, or while we're eating a meal. How do we identify when we're finished and when we're full? And that can be pretty hard to do. Next slide. This middle section here is pretty challenging when you go from neutral to being completely satisfied. And finally, we can actually skip through a couple of these slides. If we go a couple more, one more. Okay, and there we go. And then we like to close too. We look at food labels, we look at ingredients list, and we also like to make sure that we are always getting back in the kitchen. While Project Open Hand meals may be sent to you weekly for a certain period of time, again, with the longer vision in mind, connecting you with resources, but also finding ways to integrate some of the things that you're learning and that you're experiencing with these meals in your day-to-day routine. So we always end with a little kitchen inspiration and try to bring that to the table as well. Next slide. Always with understanding. I don't know if you can take a look at this and pick out which one you would identify with. Everyone comes from a different place in the kitchen. Everyone has different apparatuses to use for cooking. The kitchen looks different. So we try to meet someone where they are and understand how we can support in the kitchen as well. And this is just an example, next slide, of one of our menus that we cook in one of our classes. Some root veggies, some roasted turkey meatballs, some easy brown lentils, and some blanched veggies, just to have a nice stock, maybe some batch cooking in the kitchen to keep you supplied. And we'd love to open it up. Any specific questions you have now?
I just wanted to touch on quickly some of the questions that I was fielding in the chat. So for example, I know I spoke a little bit about the programs covered through insurance, like San Francisco Health Plan and Medi-Cal. Not all of our programs are covered through specific insurances. And then I also wanted to just throw out there, this is a lot of information about some complicated programs. So if there are any questions, we are always available via phone to help you navigate and kind of hear more about you, your needs, and then find a program that might be the best fit for you. So if you're feeling a little bit overwhelmed by the information, just give us a call. I will put, I will include that in our information at the end as well. You can always give our client services team a call and say, I think I might be eligible, but I'm not sure. Can you help me figure this out? And we can. And then I also wanted to emphasize that all of our services are completely free of charge. There was one question that I wanted to direct to you, Erica, about the difference between a registered dietitian and a nutritionist.
It's a great question, and they are not the same. So a registered dietitian goes through extensive training and certification, nationally certified, to provide medical nutrition therapy. So that means that the registered dietitian that you meet with will not only provide generalized guidance around a healthy diet and provide strategies, but will be able to monitor your lab values, for example, if you're visiting your healthcare provider regularly, and provide very tailored information for you to guide you through that process of disease management. My role, I'm a nutritionist, I'm a public health nutritionist. And so I provide a lot of guidance in classes and a lot of lifestyle coaching and guidance with regards to food and nutrition, but I'm not a registered dietitian. So I would point you in the direction of my colleagues who are, so that they can guide you through whether we're monitoring HbA1c or we're looking at our kidney function. They can provide more direct support in that way. Great question.
Then I think that Isabel is also answering some of these questions as we go. And I think that just to help everyone, in case they can't see the Q&A somehow, I'll read the answers out loud as well.
Yes.
Somebody asked, how do I sign up? And Isabel, you feel free to continue typing your answer if you want.
Yeah.
But Erica, I think that during the presentation, we mentioned there will be applications shared with the participants in the post-event email, right? And I'll make sure that I remind you about that later.
Yes, absolutely. And I see the questions here. What if I only like to eat Chinese food? Or alternatively, another attendee asked, how do I know Project Open Hand is for me if I don't like to eat everything? And these are great questions. I think something that you might want to do is to follow up with us directly and talk with us more about the details of each of those menus that I kind of gave a brief overview of. So if you have certain restrictions in terms of you'd rather not eat meat, or you'd only like to eat fish, or you prefer, if we prefer bland, we don't like a lot of spices, tomatoes, onions, things like that. We can talk through some of these things because some of our diets naturally take care of those. That said, our meal plans are established in advance. So there can be some flexibility, but that's something we would just want to talk with you about and learn more what specifically it is that you'd rather not eat. And with regards to Chinese food, we do have some of those flavors. And so again, I'd love to talk with anyone one-on-one to see if, based on our menus, if it seems like it could be a good fit.
And I think that touches on the question that was also answered here or entered here. How do I know if Project Open Hand is for me if I don't like to eat everything? And
Yes.
yeah, if anybody else has other questions, I'll go through the answered questions again and sort of just repeat them. Isabel, were you going to include something?
To what Erica said. I just wanted to also add, yes, and re-emphasize that it's always better when in doubt, just contact us and we can work with you directly. The other thing is that if you do have specific things that you do not like, groceries might be a better option for you, because then you can choose exactly what it is that you get every week.
Yeah.
And this is more of a question for other community members who might approach CHRC asking these questions. Are there language services in case they call the number we provide? Will they be able to speak with someone who they can communicate with?
Yes, we have Mandarin, Cantonese, and Spanish on staff. And then for other languages, and Tagalog. And for other languages, we work with an interpretation service.
Thanks, that's helpful. So I'll just go through and read the responses that Isabel wrote to some of these questions and entered in the Q&A. Are all programs through insurance? No, not at all. Only the San Francisco Health Plan and Medi-Cal programs are. You can call the number that I'll include in the email, but it's 415-447-2326. And then you can have a discussion on which programs would be right for you based on your financial situation and your specific needs. Next is, if you don't have a provider, how could you get the application filled out for you? The medical provider doesn't need to be your primary care provider. They can click, Project Open Hand can direct you to a clinic that will help you fill out the form in order to receive these services. Again, I'll include the important number we just talked about. And another person asked, is Project Open Hand free? And all of their services are free. And the last question is, if I don't qualify for Medicare, can I still join Project Open Hand for free? And yes, you just need an eligible diagnosis, which is what the provider helping you fill out the application fills in for. All right, I don't think we have any more questions. Erica, Isabel, it's so wonderful having you both join me today. Thank you for coming to Community Health Resource Center virtually and speaking with our community members.
Thank you all for joining, and please feel free to share widely and be in touch with any questions. Thank you for hosting us today.
Thank you.
Thank you.
Have a wonderful day.
Bye-bye.